The Ebola outbreak in West Africa, the largest that we've ever seen, was intense in September and October last year, and then started to decline significantly early in 2015. Throughout this year, it has continued to decline, with a slightly bumpy road at the end, with occasional flare-ups. But I want to stress that this has proved to be a very difficult outbreak to end, and therefore it's really important that we continue to have a high degree of vigilance right through 2016 until we can be sure that transmission is completely ended. As we enter 2016, we must be aware that the virus is still present in the bodies of many of those who have survived the disease. We reckon there are about 15,000 people who were sick and were cured. And of these, a proportion, we don't know how many, are still carrying the virus in their bodies. And it's particularly the case for men who continue to have the virus in their seminal fluid, and that means that they may unwittingly pass the virus on to others. The people who have experienced Ebola are really extraordinary. They've been close to death, and they have come back, they've clung on to life, and they have recovered. We in the United Nations system are doing is trying to make sure that every person who survives Ebola has access to the care that they need from anybody who can provide that care, whether it's from government or from a non-governmental organization, so that they themselves are kept healthy, and also to reduce the risk that they'll pass the virus to other people. When I look at the outbreak and my involvement in the outbreak since August last year, and I link that to other work that I have done in public health over the last 3 decades, I am consistently humbled by the power of individuals, communities, and coordinated groups of people to transform the lives of others. In this outbreak, we have seen numerous examples of individual and collective courage, bravery, commitment, compassion, and continuous selfless giving. This has been the most remarkable opportunity to see human generosity, human commitment, and the human spirit in its best force that I've ever seen in my life. And I hope that we can remember this forever, because what it shows is that if we pull together to respond to a desperately difficult situation of suffering for thousands of people, if we pull together to do it, we can be transformative, and we can make life better for all, and we can do it without fussing about who we work for or what our motives are. We can do it because we believe in the good of humanity. That has been my real lesson, and that's one that I will never forget.